We already discussed some things about a VSD, but you know the review questions are coming. So let's look at our VSD diagram. What part of the septum do most ventricular septal defects occur in? The membranous or muscular? It's the membranous. Of course it's the membranous, because it is such a thin piece of tissue compared to the muscular interventricular septum. The murmur of a VSD is best heard in the tricuspid area because the right ventricle is closest to the chest wall in this area. Blood is flowing from left to right, causing a vector flow across this ventricular septal defect. So our flow vector is going this way. There is no flap or valve over this defect, so blood will be pushed over this defect whenever there is contraction of the left ventricle that is pushing blood into the right ventricle. When would this be? Well, systole, right? Whenever that much more powerful left ventricle contracts in systole. You bet. That's when it's going to happen. That huge pressure gradient creates a very powerful flow from left to right, which is why the murmur is such a harsh sound. So I repeat, a VSD murmur is harsh sounding because there's a huge flow and pressure difference from the left to the right side. Now the actual physiologic explanation for this is that if you consider that the right ventricle is connecting to the pulmonary artery, which is connecting to the very compliant, low resistant circuit, while the left ventricle is connecting to the aorta and systemic circulation, which is a higher resistance. The reason for this pressure gradient is that there's actually much less resistance for blood to flow this way across this defect. If this VSD is large enough, you can actually have the pressure in the right ventricle and the pressure in the left ventricle equilibrate. So you can think about it either way you want. They're not going to test you this in depth about what pressure value you might read with the pulmonary capillary wedge pressure or anything like that. They're going to test you with the auscultation of a murmur and give you a vignette that should make you think of VSD. You can make a VSD louder by increasing the flow over this defect. And a great way to do that would be to increase the afterload by manipulating the pressure in the aorta. And we can do that by changing the afterload due to compressing the peripheral resistance arterioles with a hand grip movement. So that will increase the afterload, and that will cause more blood to take the path of less resistance, which is into the pulmonary circulation. Remember how we said compressing the peripheral arterioles would decrease the diameter of the vessels that are responsible for the total peripheral resistance, causing the left ventricle to work harder and reach a higher pressure if it wants to pump blood into the aorta. Do you think the blood in the left ventricle would rather try to take a route with less pressure to fight against? Somewhere like across the VSD into the right ventricle and into the pulmonary vasculature? Of course. What's located around the left clavicle? How about where we previously had a connection between the aortic and pulmonary artery? We are talking about the murmur associated with a patent ductus arteriosus. Why would our ductus not close? Here is our ligamentum arteriosum, which is the remnant of our ductus. If this were not to close, there are two common causes for this, and that would be prematurity and congenital rubella. If you were born early, you just didn't have enough time to close it. Now, if you get rubella from your mother hematogenously, the rubella virus loves, just absolutely loves, to infect endothelial cells of the ductus and the heart in general. it can disrupt the normal contraction and closure of the ductus due to infection of those endothelial cells. The murmur of a patent ductus arteriosus will be heard the entire time, no matter if you think you're in systole or diastole, because blood is always going to be flowing through the ductus. Think back to your fetal circulation. What is the purpose of the ductus arteriosus? It allows blood that is being pumped into the pulmonary artery root by the right ventricle to bypass the high resistance of the contracted pulmonary vasculature bed so that oxygenated blood can be directly placed into the aorta. Alright, we have another flash quiz upon us. Regarding auscultation of the heart, in what areas are the murmurs of pulmonic stenosis and pulmonic regurgitation best heard? So this question is particularly easy for us because we just discussed the auscultation of murmurs. Remember, pulmonic stenosis is due to some sort of pathology associated with the difficulty of the pulmonic valve opening when the right ventricle is in systole. And pulmonic regurgitation is also associated with the pulmonic valve, except that it occurs in diastole, while pulmonic stenosis occurs in systole. With this in consideration, what would your answer be? The pulmonic area, which is the left sternal border at the second intercostal space, and the left sternal border respectively.